Hi, my name's Hannah Tanner, and I'm the hospice social worker with Community Nursing Services in Northeast. This video is going to go over some common hospice misconceptions or myths that we come across a lot whenever we work with patients and families, so I hope you find it useful. And here is Hospice Myth 101. Hospice myth number one is that hospice hastens death. So hospice is only available to people who are not seeking curative treatment. Hospice does not cause people to pass before their time. Research actually shows that ill people receiving hospice services have a greater quality of life during that time than people who are equally ill who avoid hospice services. Um, Hospice myth number two is that once receiving hospice services, there's no going back. So this is just not true. People can enter hospice services and then sign out the next day if they choose they want to seek treatment or if they find that it's not for them. And then if they decide they want it back, they can get it right back as well. So that's just not true. Hospice myth number three is that hospice is a place. So hospice is a kind of care. It can take place at home, in someone's home, in a skilled nursing facility, or even a personal care home. So it's not a place, it's a form of care that can meet people where they're at. Myth number four is that hospice is only for those with just a few days to weeks to live. This isn't true. Hospice reports actually show that the average length of stay for someone on hospice is 76 days. And to qualify someone for hospice, they usually have a prognosis of 6 months or less to live, but there are people that have been in hospice for over a year as well. So myth number five is that entering hospice means giving up control of your care. This is just not true either. It's meant to increase the quality of life for terminally ill people, and it's meant to meet the various needs of patients and families. Patients and families can also choose to request, refuse, or question services at any time as well. Hospice myth number six is you need a doctor's referral to enter hospice services. This is not true. Anyone can make a referral to hospice. A family member, a person, the terminally ill person. It is true that you do need a doctor's order to proceed with hospice services, which usually the hospice facility will work on that for the patient. Myth number seven is that hospice can only be given at a hospital or hospice facility. We kind of talked about this, but hospice can be given wherever the patient is at. Patients who can't really live by themselves anymore, we find that they can go to relatives' homes, skilled nursing facilities, personal care homes, and sometimes, there are hospice homes that can treat the patient there as well. Myth number eight, hospice and palliative care are the same thing. This is a big misconception that we come across at times. They both aim to alleviate pain and suffering and enhance quality of life, but the difference is that hospice is non-curative and palliative care can be given at the same time as curative treatment. Again, both are to alleviate suffering, but palliative care is along with seeking a cure, while hospice is not cure seeking. So there's that. And then myth number nine is only people with cancer can receive hospice care. This is not true. It's true that people obviously need a terminal diagnosis to start hospice services, whether it's end-stage COPD, renal failure, heart failure, or Alzheimer's. The list goes on. It doesn't just have to be for cancer patients. Myth number 10 is that hospice care is expensive. Hospice is actually fully covered by Medicare and Medicaid and many other private insurances. All of the patients that I've had so far in my 2 year plus long career have not paid anything out of pocket for hospice services. Myth number 11 is that hospice is 24/7 in-home care. This is not true. Visits from the nurses and the aides and social workers are anywhere from 30 minutes to an hour, depending on what the need is for the patient. And then they don't stay in the home with the patient and family. They're just kind of in and out to make sure that the patient and family are okay. But hospice is available on call 24/7 should any needs arise. So that's a big myth that we come across at times. Hospice myth number 12 is that hospice services end when the patient passes. This is not true. Hospices are required to have bereavement counselors who follow up with the family for about a year after the patient passes, just to make sure they're doing okay and to have some of that extra follow-up. So I hope that I clarified some of the common misconceptions with hospice. If you have any questions, I encourage you to research them or call any hospice agencies that you know and just ask. Here are the resources that I got some of my info from. Here we go. All right. Thank you.